Hey, future respiratory therapist. Got a topic today that I want to talk to you about, and that is quality therapy being greater than quantity of therapy. Okay, now this is a mindset that some of you might struggle with as you find yourself getting into the profession post-graduation. Now, the first thing some of you may say is, well, Joe, why are you gearing this towards respiratory therapy students instead of gearing this towards current respiratory therapists? And my answer to that is this. Future respiratory therapists, you guys are just that. You're the future mindset and the future culture that's coming into the workforce. And quite frankly, I'm sick and tired of the RT profession as a whole sucking. And I don't mean that to discourage you, like, oh my gosh, maybe I need to go into something else. No. You're right where you need to be. So don't go into anything else because we need you. But the truth is that the current mindset in respiratory therapy, and this isn't all respiratory therapists, it's not all respiratory therapy departments, it's just the majority of what I've been a part of and what I see on a daily basis. Okay? So don't misunderstand me. If you're out there already doing this, then fantastic. If your department already gets this, then fantastic. If you're a director by chance watching this and you get this, then keep up the strong work. But as a whole, we kind of suck as a profession when it comes to quality care being valued over quantity of care. So I want to break this down for you today and show you the overall impact of quality over quantity. First of all, you're going to see some things on the board here that you need to understand what they mean. The first one is misallocation. Now, when we say the word misallocation, that's a healthcare term that refers to the inappropriate, ineffective, or therapies that are not indicated for certain patients. And so you have supplies and you have manpower going to therapies that don't necessarily even need to be done. That's misallocation, where resources are being used and spent to provide therapy to patients that either it's not the correct therapy or there's not an indication at all for that therapy. Okay, that's misallocation. Now, the second thing you see on your board here is escalation of care. This is one of the biggest impacts I'm going to tell you about today. Escalation of care is when you have a patient in the hospital that seems to be doing well, and then suddenly they're not doing well. And suddenly they're on a floor with plans for discharge in 12 to 24 or 48 hours. And suddenly they go downhill, and now they're in the hospital for another 5 to 6 or 7 days. That's escalation of care. The next thing you see is total number of hospital days. Now, total number of hospital days is important because anytime you can get a patient in the hospital and out of the hospital in the fewest possible days, then that's going to equal revenue for the hospital, a greater revenue than somebody who's in the hospital for 12, 14, 30, 60, 90, 120 days. Okay, so total number of days is important. And then the last one there is patient satisfaction. Now, you can go to Home Depot right now, and on the receipt, it's going to give you a link to take a customer satisfaction survey. You can go to Wendy's, Jack in the Box, McDonald's, everything's customer satisfaction. Well, the hospitals are no different. They care about their patient satisfaction. And in the consumer world we live in, patients choosing to come to your hospital because other patients leave happy is important. Okay? So patient satisfaction obviously comes in to this conversation. Now, I'm going to talk to you about what quality care looks like and what quantity care looks like, and then tie them in to these 4 points that you see on the board here, okay? Now I'm going to start with quantity of care because that's much easier to understand, okay? So when we say quantity of care, we're talking about number of treatments. And when I say number of treatments, what I'm saying is going out with the mindset of getting done as many chargeable therapies as you can get done in 12 hours. Maybe it's an 8-hour shift. Maybe it's a 16-hour shift. I don't care how long the shift is. However long your shift is, your goal is to maximize the number of chargeable therapies that you do. Okay? So think of quantity therapy as being money driven. So as many chargeable items as you can do is going to create more dollars for our department today. And I wish I could do this conversation. As a matter of fact, there wouldn't be a need to do this conversation, to have this conversation if money wasn't a part of healthcare. But it is. So that's the first thing you need to understand is that money matters. And healthcare facilities operate on budgets, and they have to make money to keep their doors open. So don't confuse this entire piece with, oh, Joe's saying money doesn't matter, because it does. Okay? Now, you as a respiratory therapist, if you go out with the mindset of getting done 50, 60, 70, 80 treatments in a shift, and your goal is to get them all done, because that's what your department's asked you to do, then just understand that you're operating on a quantity-driven mindset. I got to get all these done because I have to get this number of treatments done, and these are all chargeable items, and that's going to make money for my department, which means if my department makes money, then we're indispensable. That's false. Don't believe that. Okay? So the other thing I want to say about quantity therapy is that you need to recognize how this happens. It happens primarily with, and this is just talking the field of respiratory therapy, it happens primarily with overloading you as a respiratory therapist with a bunch of like I said, chargeable therapies to do, which is most commonly albuterol, small volume nebulizers, maybe an initial IS therapy. Now, I talked about IS therapy. I think it's greatly beneficial to RT departments when it comes to quality RT, not when it comes to quantity, which is why so many departments have gotten rid of IS therapy. That's in another video. Go search it. I think it's titled The Impact of IS Therapy. I don't remember the rest of the name of it, but it's there, the impact of IS therapy, okay? Greatly underutilized and given away because it doesn't make sense on the dollar-driven mindset, okay? So quantity therapy is the therapist that goes out and says, I have 60 treatments to do today. I'm going to start them all at 7:15, 7:20, 7 o'clock. I'm going to be done with 12 treatments, 16 treatments, first round treatments. Maybe I have 16 of them. And I'm going to be done by 8:30 so that I can go get breakfast. Now, you got all your therapies done, and congratulations. You did a fantastic job when it comes to quantity therapy, okay? And you got your breakfast in before 9 o'clock, so good for you, okay? The problem with quantity therapy is that it doesn't truly impact patients. Okay? It doesn't truly help you identify the needs of your patients or even take the time to impact your patient's hospital stay. And that's what I want to talk about when I talk about quality therapy. Now, when you think quality therapy, if I told you that over here we're talking about the number of treatments given, when we talk about quality therapy, we're going to focus on the impact of the therapies you give. Okay, that's a completely different story than giving 16 first-round treatments versus giving 10 or 12 quality first-round treatments that truly impact the patient's hospital stay. And if I told you that quantity therapy was money-driven mindset, then quality therapy, you need to understand, is an impact-driven mindset. So you need to approach your patients with this idea of, I'm here to care for you. You have this therapy ordered. I'm going to give it to you, but I'm going to give it to you in a manner that impacts your hospital stay, that ultimately helps you get better. And if this is not the appropriate care for you, I'm going to take the time to understand you, your disease process, and what your needs are from a respiratory therapy standpoint. As opposed to, you have an albuterol treatment ordered, here it is, I'll be back in 10 minutes to take it off of you. And you may or may not come back. Okay? So the thought process is number of treatments that you're going to give versus the impact of the treatments you're going to give and how that's going to truly impact your patient's hospital stay. Okay? Now, I gave you these 4 topics at the beginning of this video, and I explained each of them to you, and now I want to tie them into quality versus quantity and see truly which one we think is ultimately going to benefit, first, our patients, second, our department, and third, our facility better. Okay? When you focus on the number of treatments given and you have a dollar-driven mentality, a revenue-driven mentality, okay, then the misallocation of therapies will go up, which means you're wasting resources. Anybody who knows me knows that I hate wasting resources. And when I talk about resource to me personally, I'm talking about my time. I hate things that waste my time. So if I go into a patient who has an albuterol SVN treatment ordered and there's no indication, it drives me crazy. Because how can I impact this patient with the therapy ordered? Well, I have to figure that out on another way. Maybe it's getting that patient a cup of coffee. But that albuterol SVN, just speaking honestly, is not what's going to impact that patient's hospital stay or their patient satisfaction. Okay? So misallocation goes up. Now, when we talk about escalation of care, we're talking about the mindset of a respiratory therapist who can identify when a patient is getting worse as opposed to getting better. So obviously, if you're just slapping treatments on and then going to the next room, then you're going to have a hard time identifying those patients that are getting worse. You're probably not going to take the time to assess your patient and identify a worsening patient versus a patient that's getting better. So escalation of care with a quantity-driven mindset will go up. Now, if escalation of care goes up, then obviously total number of hospital days is going to go up. So like I said, instead of being in the hospital for 3 or 4 days, now the patient's in the hospital for 8 or 9 days, or maybe much longer than that. Finally, when we talk about patient satisfaction, I promise you this, if you remember nothing else, patients will fill out surveys. Patients will remember your name. And they will remember your name in one of 2 circumstances. Either you gave exceptional quality care or you gave exceptional crappy care. And you do not want your name on a survey associated with crappy care. Okay? And typically they won't even remember your name if the care is crappy. They'll just remember the respiratory therapist came in, put a mask on me, disappeared, I never saw him again. 3 hours later, a nurse or another RT came in and took the mask off. Or I got tired of wearing it and I took it off myself. So patient satisfaction will go down. Guaranteed. slapping treatments and going to the next, or like if we talk about stacking treatments, reduces patient satisfaction. Okay? Now, just the opposite of all this is true when we talk about quality therapy. If you're doing quality therapy, then you're taking the time to assess your patient, to figure out their true needs from a respiratory therapy standpoint, and then seeking out the orders that are going to support their true needs. So you're actually going to reduce misallocation of therapy, which is ultimately going to reduce the time you're wasting with patients that don't even need your help. I promise you, on any given day, you're going to take care of a patient that truly doesn't need your help. It's just the way it is. I've seen it for too long, and I know that if you're given 60 treatments in a day, over the course of 15, 20 patients, I guarantee you at least 25% of them probably don't even have an indication for any respiratory therapy. And if you can identify that and get that order changed, even if you just get it changed to a PRN treatment, then at least you're putting your eyes on your patient and saying, just making sure you're doing okay, strong work, I'll come back and check on you in a little bit. That's not a waste of time. But going in and giving somebody who doesn't need a therapy, doesn't need treatment every 4 hours, that's not quality, that's quantity. So quality therapy decreases the misallocation of therapy. Also, if you're giving quality care and you're thinking impact driven, every patient you stand in front of is the most important patient in the hospital at that time, then you will seek out and be able to identify patients that are getting worse versus patients that are getting better. And that will reduce the escalation of care. When you reduce the escalation of care and you treat problems on the horizon before they're actual problems, then you will ultimately decrease the total number of hospital days. Your patients will go home quicker and they will go home more satisfied. So patient satisfaction goes up. Now, while quantity therapy may increase revenue in the short term for this day or for this shift, okay, quality therapy, by decreasing the misallocation of therapy, by decreasing the escalation of care, by decreasing the total number of hospital days, and by increasing patient satisfaction, will increase revenue on the backside of each patient's hospital stay. Now, some of you may disagree with this. If there's a director out there watching this and you want to get at me about it, then come on, I'm ready to hear it. I'd love to sit down and talk to you and figure out the quantity-driven mindset. Because for me, it's real easy. And for you future respiratory therapists, it's real easy. Do you want to be a respiratory therapist that goes in with the mindset of getting done and checking off boxes for tasks that you've completed so you can get to breakfast sooner or you can get back to the break room quicker so you can gossip about the day shift team leader? Do you want to approach each patient with the idea of I got to get you done, which is going to lead to a piss poor assessment of the patient, which is going to lead to piss poor decision makings for the patient, and overall a piss poor job done by you? So you can what? Increase the number of total charges for that day? Or do you want to be a therapist that approaches each patient like they're the most important, with the idea of impacting every patient and meeting every patient's needs, not their orders, but their true needs, providing for them what they need, being kind, being compassionate, making them feel like the most important patient in the hospital, which will ultimately lead to a high quality of care that you deliver. I'm going to end on this. If you adopt the quantity mindset, you will burn out very, very fast. If you adopt the quality mindset, I promise you, you will leave every single day being fulfilled in your career as a respiratory therapist. Leave me your comments below. I'd love to hear what you think about this. If you think quantity is the way to go and you can prove it to me, I would love to have this conversation. Okay? So, in the end, go be a quality respiratory therapist, not a quantity driven. Go be great.